Good afternoon. I'm Bethany Saxon, the Director of Communications at the Center for Public Health Law Research at Temple University. Thank you for joining us for this webinar where we will explore the impact of inclusionary zoning laws and policies in using legal epidemiology. I'd like to cover a few housekeeping notes before we begin. We'd like to quickly acknowledge that this project and the presenters here were supported by the CDC and ChangeLab Solutions, and that the views expressed here do not reflect the official policies of the U.S. government. Our presenters today will spend some time at the end of the webinar answering questions. Please feel free to send questions as you may think of them throughout the webinar using the Q&A box. To submit a question, open the Q&A panel using the ellipsis button on the bottom of your screen and selecting Q&A. Once the panel is open, you may select all panelists from the drop-down menu. You may then type your question and click Send. Our moderator today is Montrese Ransom. Montrese Ransom, JD, MPH, currently serves as a Senior Public Health Analyst and Team Lead for the Public Health Law Training and Workforce Development with the Public Health Law Program, PHLP, in the Office for State, Tribal, Local, and Territorial Support at the Centers for Disease Control and Prevention. Montrese, I'll now hand this over to you.
Thank you so much, Bethany, and thank you to everyone who's joined us this afternoon for this program. I'm going to start us off by introducing our two speakers, and then I'm going to talk briefly about legal epidemiology and policy surveillance and the framework for the project that our presenters have been participating in over the last year. I'll then turn the mic over to our speakers and let them provide the substance of our webinar, and then I'll return to moderate the Q&A portion. So our speakers today are Hannah Kite and Deanna Derica. Hannah Kite is currently a Regional Health Officer at Cook County Department of Public Health, and she manages the department's behavioral health initiatives. Hannah has analyzed and developed local and state policy projects with the University of Minnesota, the Active Transportation Alliance, and as a fellow for the National Complete Streets Coalition. Her work centers on the use of policy, systems, and environmental levers to create inclusive, sustainable, and thriving communities. Along with Hannah, we have Deanna Derica with us today. Deanna currently serves as the Director of the Lead Poisoning Prevention and Healthy Homes Unit at the Cook County Department of Public Health in Illinois. In that role, she provides strategic directions to the unit, implementing both program improvement and policy systems and environmental changes that aim to advance health equity. In addition to leading the lead poisoning prevention team, Deanna also works on the agency's policy initiatives, as well as other issues related to early childhood health and health well-being. Before joining the Department of Public Health, Deanna served in the Illinois Office of Early Childhood Development and worked for both early childhood advocacy and social service organizations. Deanna holds a Master of Public Health focused on maternal and child health from the University of Illinois at Chicago. So before I turn it over to our panelists, to Hannah and Deanna, I want to make sure that we're all on the same sheet of music with regard to understanding what legal epidemiology is, because that's really going to be the heart of what you're hear about today. So state and local health departments are critical participants in policy surveillance and legal epidemiology. The work of health departments require awareness and understanding of relevant state and local laws that can be furthered by access to information about the laws of peer jurisdictions. With that in mind, in 2018, we began working with several state and local health departments to conduct legal epidemiology projects. Training and technical assistance were provided by my colleagues in CDC's Public Health Law Program, along with our partners at ChangeLab Solutions and the Policy Surveillance Program at Temple University's Center for Public Health Law Research. One of the main goals of the project was to test the willingness and the capacity of health departments to do this work, to conduct policy surveillance of state and local health laws, and to identify the barriers and facilitators for future projects that look like this. So we also wanted to really work to build workforce capacity to do legal epidemiology, to perform legal epidemiology assessments and policy surveillance projects in-house. So as you'll hear in a few minutes, the project has been a huge success. And a prime example of that is the work done by Cook County's Department of Public Health, which you'll hear about today. So I'm going to quickly, as I mentioned, kind of provide a framework for legal epidemiology, make sure we're all in the same sheet of music. So using the chat box, and you can access the chat box with the little message emoji on the bottom of your screen. But if you would, using the chat box, I'd love to know how many of you all on the line know what legal epidemiology is. How many of you feel that you can define it? And again, the chat box should be accessible using the comment box, the little message box emoji that's on the bottom of your screen. I'm sending everyone a note now. All right, looks like it's gone. While you're typing in your responses to the question, I'll go ahead and offer a definition. Legal epi, also referred to as public health law research, is really the scientific study and deployment of law as a factor in the cause, distribution, and prevention of disease and injury in a population. So this includes both direct relationships between law and health and relationships that are mediated through the impacts that law may have on health behaviors and other processes and structures that impact population health. Legal epi uses a scientific approach. That's one of the key important factors around legal epi, a scientific approach to understanding how law influences the delivery of public health law services, and population health overall is really important to assessing whether it does and what law-based strategies really work best. So policy surveillance is the methodology for creating legal data that may be used in legal epidemiology studies. Officially, we define it as the systematic collection, analysis, and dissemination of laws and policies across jurisdictions and institutions over time. And it looks like most of our participants do have an idea of what legal epi is, so that's excellent. So why do we do policy surveillance? The primary reason is because it creates data. Reliable data that can be used for evaluation. But we see so many other benefits to this process, and we know our panelists are going to expand on some of these. They include things like filling the need for accessible, nonpartisan information about status and trends in law and policy. This is just the facts. We provide a just the facts approach, an observation rather than interpretation that allows policymakers to make better decisions around health policy. This work also helps us track changes over time and to measure. Policy surveillance tells us or asks the question and allows us to answer the question, are we making a difference? Are we seeing movement? If there is movement, what does that look like in a particular area? It helps us diffuse innovative policy ideas, particularly through data visualization, like the maps on lawatlas.org. We're able to clearly articulate in plain language the contents of laws and policies. And again, we have this visualization on our website for CDC's Public Health Law Program as well. The point is to really translate the information we collect in legal epi data into tools that folks in the field can use, so that policymakers and legislators and practitioners can easily see and compare their jurisdiction to others to find good ideas and identify where they stand in the status of where things are. It also helps to build workforce capacity. The sort of question and answer format of policy surveillance is great for non-legal audiences, our practitioner partners in the field, particularly for our public health workforce, where there may be few, if any, lawyers on staff who can answer those questions. So that's a little bit of background on policy surveillance and legal epidemiology. I hope that's piqued your interest to learn more and to learn more about how this actually works in the field. And so with that, I'm going to turn the mic over to our speakers, Hannah Kite and Deanna Derica.
Thanks very much for the introduction, Montrese. We're excited to present about our project. We wanted to acknowledge one of our team members who couldn't be with us today, Dina Masuda Barnett, our Deputy Director of Public Health Programs here at our health department, was instrumental in securing the opportunity to work on legal epi and throughout the process. She's recovering from a bad cold, but I believe she's here with us in spirit for sure. In today's presentation, we'll start with some context about our jurisdiction. We'll review the project selection process, which was a crucial step for us. We'll explain inclusionary zoning, give an overview of the research process and results, and then we'll share some thoughts about how this pilot project will inform our future work.
Great. And again, we're Hannah Kite. Hannah's the Regional Health Officer here focusing on behavioral health and health equity, and I'm Deanna Derica, Director of the Lead Poisoning Prevention and Healthy Homes Unit here. And I'm having trouble advancing the slide. That one? Sure. Would you help? Thanks. So we'll talk a little bit about our health department first. We work here at the Cook County Department of Public Health. We serve suburban Cook County in Illinois. Our jurisdiction does not include the city of Chicago, and it also does not include a few other suburban municipalities that have their own state-certified health departments. But even so, we serve 2.5 million residents in 125 municipalities and 21 unincorporated areas in a region that covers 1,400 square miles. The median family incomes range from $22,000 to $211,000. Some of the poorest communities in the nation are in suburban Cook County. As you can see, it's a politically complex and large geographic area. Thanks. So why did we participate in the legal epi process? We were really interested in the legal epidemiology opportunity when it arose. Legal epi tools and principles seem to be a great fit for our health department, especially as our work continues to shift from direct service and health programming to policy, systems, and environmental change initiatives. We saw this as an opportunity for increased collaboration with cross-sector organizations and partners, and it really fit with the data expertise that we're developing. And we saw it as an opportunity to really add value to the work that we do with municipalities.
The longest and one of the most fruitful phases of our project was the project selection process. We started with one topic and then switched to another, but along the way we learned some things about when it made sense to use legal epidemiology. When we were first interested in a legal epidemiology project, we chose health and all policies as our topic. We were interested in potentially developing a technical assistance program for local municipalities to develop a health and all policies resolution. We were also interested in supporting the development of a countywide policy. The City of Chicago had just passed a policy, but we were interested in policies from other large counties similar to ours. After some research and talking with our technical assistance providers at Temple and the CDC, we learned that the CDC had conducted a legal epi analysis of health and all policies. And since that analysis, there hadn't been any additional policies that had been adopted. When we reflected on what we were hoping to learn from health and all policies, we were most interested in the process of developing an initiative, and there was little in the policies that we read that illuminated that process. Furthermore, there were comprehensive reports in the great literature, some of which are pictured here on this slide, that answered some of the questions that we had about developing an initiative. So we decided to start over. We looked at our initial list of project ideas, and we decided to look at affordable housing policies, especially with Deanna's expertise in housing-related health initiatives. One policy that stuck out was inclusionary zoning. So we're not affordable housing experts, so we reached out to planners at two organizations, Ricardo Lopez at CMAP and Kyle Smith at the Metropolitan Mayor's Caucus. CMAP, the Chicago Metropolitan Agency for Planning, is our region's metropolitan planning organization, and the Metropolitan Mayor's Caucus is a public policy forum for municipal leaders from across the Chicago metro region. Ricardo and Kyle were extremely helpful in flagging important elements of inclusionary zoning policies and identifying some critical questions about inclusionary zoning policies and their implementation. CMAP also identified resources related to inclusionary zoning policies, including a local resource called Regional Housing Solutions. Regional Housing Solutions is a resource that identifies housing strategies effective in 8 different submarkets of the Chicago metro region. Submarkets are areas that share characteristics such as the age of housing stock, affordability, market activity, and socioeconomic indicators. Based on the Regional Housing Solutions tool, we were able to confirm that inclusionary zoning was a strategy that could potentially be effective in our jurisdiction of suburban Cook County. Kyle and Ricardo were also curious about why we wanted to focus on a single policy. They emphasized that there were other affordable housing strategies that were especially relevant to our region, such as community land banks. We really valued this perspective because it helped us consider how legal EPI could be used as a tool in future work with partners. Perhaps in the future, we'd select more than one policy to evaluate. So what's inclusionary zoning? According to the Lincoln Institute of Land Policy, inclusionary zoning is any program or policy that requires or incentivizes the creation of affordable housing when new development occurs. This means that any time a person or company purchases land and builds housing on it, part of that housing would be reserved at a price point that's affordable for low to moderate income individuals. According to a study by the Lincoln Institute of Land Policy, there are 886 jurisdictions across the country with inclusionary zoning policies. So just by comparison, over 1,400 jurisdictions across the country have adopted complete streets policies. New Jersey, Massachusetts, and California all have state policies for inclusionary zoning that are either statewide or promote local policies. And as a result, most of the policies in the United States are found in these states. While the data is limited, the Lincoln Institute study found that over 170,000 units of affordable housing have been created as a result of inclusionary zoning policies. Inclusionary zoning policies have also generated $1.7 billion in funding for affordable housing through impact or fee in lieu payments. These figures are thought to underestimate the impact of inclusionary zoning programs, and some people have raised concerns that inclusionary zoning has provided only a limited amount of affordable housing.
So as Hannah mentioned, we work a bit in the healthy homes space, but we're really interested in thinking more about healthy, safe, and affordable housing. So understanding inclusionary zoning better seemed to be a way to build our knowledge and our expertise. Inclusionary zoning has specific benefits in the housing market that we're interested in. According to the Chicago Metropolitan Agency for Planning, inclusionary zoning policies tap the private development market, integrate affordable units into market price developments, and create more for-sale units for those at the higher end of the low-income spectrum. We'll take a moment to review now some of the key components of an inclusionary zoning policy. These were things that we identified with the help of our partners and became kind of the core of our legal epidemiology policy surveillance. So we looked at thresholds. When is an inclusionary zoning policy activated? For instance, is it triggered when a developer is building a 4-unit building or when a developer is building a 10-unit building? Or is it triggered only for adapted reuse projects? When does a developer need to participate is the answer to that question. What set-asides exist? What percentage of the units in a building being built or redeveloped must be reserved for affordable housing? We also looked at incentives. If developers participate, if they must participate, what else do they receive? Are there additional perks to building affordable housing? Do developers get relief for application fees or parking requirements, for instance? Alternatives are something else we looked at. Are there other ways that developers can meet the affordable housing threshold requirement? Can they build units at another site instead? Can they pay a fee instead of integrating units into their market rate development? And finally, we looked at applicability. Who can live in the new affordable units and how long are they maintained as affordable units? These are the income requirements for eligibility, which is usually a percentage of the area median income. Some jurisdictions also express preference for people who meet the income requirements and are already living in the municipality. So as a health department, we are focused on supporting policies that improve the health of our most underserved communities. Inclusionary zoning is not the only strategy that increases affordable housing. And while inclusionary zoning isn't designed to create affordable housing for the most low-income families and individuals, it is one strategy in a comprehensive, affordable housing approach that could include strategies as well as land banking or the creation of accessory dwelling units. Inclusionary zoning was a good fit for this project because it provided an opportunity to learn about one affordable housing strategy, was the right size and scope for the time and staff capacity that we could devote to the Legal Epi project, and it had the potential to be useful in the technical assistance that we provide to municipalities in our jurisdiction. So now let's talk a little bit about the Legal Epi process itself. So to begin, we selected 10 inclusionary zoning policies based on identification of best practices. We especially looked for local policies that might tell us more about the flavor of initiatives specific to our jurisdiction. So you can see on the slide that we looked at Irvine, San Diego, Santa Fe, and Boulder. We looked at Lake Forest, Evanston, and Highland Park, Illinois, which are close to where we're at here in suburban Cook. And we looked at Burlington, Vermont, Stamford, Connecticut, and Cambridge, Massachusetts. Next, we developed coding questions that gathered information about the key components of inclusionary zoning: the thresholds, the set-asides, periods of affordability, developer incentives that we discussed a few slides back. We also worked with our partner CMAP for input on those coding questions to make sure we were capturing the core elements of inclusionary zoning policies. And then next, we collected policies and analyzed their content. This is a short sentence that hides a lot of work. We really engaged in taking a really careful and long look at all of those policies. And we used a software package that helped us to find and document the answers to our coding questions and cite exactly where in the resolution, law, or ordinance that provides the evidence for the answers that we chose. We compared those answers across jurisdictions to take a look at the full picture of what was included in those 10 localities. When we completed that, 2 coders met to discuss any differences we had in the answers we came up with. For example, if one person said no developer incentives exist, but another person said no, there's an incentive to building units off-site, we discussed why we diverged in our answers. In our first batch, we coded 5 different policies, and we had a 23.2% divergence rate. But in batch 2, we were at 15.7%. So we got a little bit better at understanding the process and finding the information in the ordinances and rules. And then once we reached consensus with our answers, a third member of our team conducted quality control. So we'll present our results next, but we wanted to share one caveat about them first. Our Legal Epi project was just a snapshot of selected policies at one point in time. Inclusionary zoning and affordable housing are definitely very fluid. In some places, like San Diego or in Stamford, inclusionary zoning policies are still being re-examined and refined. Okay.
Here are the major findings from our analysis. We'll start with the similarities between the policies. First, the vast majority of policies made it mandatory, not voluntary, for developers to create affordable housing. This was not surprising for us because this was an element of inclusionary zoning policies that our partners had identified as a critical component, and because the policies in our sample had been identified as model policies. Second, all but one policy explicitly stated that fee in lieu payments contributed to the Affordable Housing Trust Fund. And third, the most popular, if you will, developer incentives were density bonuses and permit fee reductions. And this mirrors national trends in a Lincoln Institute study of 273 inclusionary zoning policies. About 80% had a density bonus incentive, and about 40% had a fee reduction or waiver for permit fees. There were additional areas of convergence. Most policies required that developers set aside about 15 to 25% of their units as affordable housing units. There was also Additionally, most policies had a low threshold for when developers were required to create units. So 7 out of the 10 policies required that developers provide affordable housing if they were building 9 or fewer units. The outlier was Irvine, which set the threshold for the creation of affordable housing at 50 or more units.
And additionally, we found areas where there were differences in policies, right? Municipalities definitely tailored the income limits for who could receive the affordable housing or who could live in the affordable housing units to their jurisdictions. Municipalities also tailored their preferences for people living in the affordable housing units once they met the income target. And those preferences included things like, preference for people living in the municipality, for senior citizens, for folks who worked in professions like emergency responders or teachers, and for parents of those living in the municipality. We also found that municipalities were especially varied in the length of time that restrictions on affordable housing units existed, especially for rental units. Only 2 of the 10 municipalities had the same length of affordability requirement. Now, the length of affordability requirements for rental units ranged from 10 to 99 years, and 3 of those policies were under 30 years. In contrast, 7 of the municipalities had permanent or 99-year requirements for owned units. So it really, gave us pause to think about the difference between those owned units and the rental units and how that gets played out then in affordable housing in a community. 90% of the policies in the national sample had term limits of at least 30 years. Okay. So based on what we found, both in our understanding of inclusionary zoning policies and how they work in communities, and based on our understanding of how legal epidemiology could be applied in our health department and how our staff could use it, this project was really valuable. It helped us to understand better how legal epi can be used as a tool to make the connection between policy and health. And in that process, we definitely encountered some challenges. The legal epidemiology process was really time-intensive, especially at the start. Without lawyers on our staff, some of those basic pieces, like looking at the adoption date for an ordinance, were unclear and a little more difficult than one would expect. And I'm sure, like all of us, we had to juggle this project with competing priorities. We overcame those challenges by establishing a central point person, a project manager almost, who was responsible for moving the work forward and kept us true to our timelines. We also learned that this new complex process takes a lot of brain power. Context switching was challenging. We couldn't just squeeze in a little work on this during the last 30 minutes of a day. We really had to set aside some dedicated time to being thoughtful and engaged in the legal epi process. Third, we learned to ask our technical assistance providers and external partners about existing legal epi research. Some projects were not easily identifiable through the internet searches that we engaged in. And finally, we so appreciate the support of our technical assistance providers for the little and big questions. Temple's Andy Campbell was always ready to assist. Given all those challenges, there were definitely benefits to engaging in the legal epidemiology process. Our legal epi project gave us an opportunity to really engage with partners over issues that we were both concerned about, and it gave us the opportunity to learn more about policies that impact social determinants of health. One of the biggest benefits of engaging in legal epi is the way that it builds capacity in policy surveillance. We found it to be a really structured, rigorous team approach to policy analysis. It ensured that we were all asking the same key questions and then answering those questions in the same way. It helped us to capture the data in a way that we could verify, and really importantly, we can go back to the analysis that we completed and understand easily the conclusions we drew and why. The process really forced us to refine and define our questions in the beginning. We had to really understand what it was we were looking for and what we were talking about so that we were sure that the answers would meet our criteria. And this is such an important part of understanding and being able to share the data that you collect and be precise as you talk about it. I know Montrese talked about policy surveillance in the beginning as creating reliable data, and I can say that this, compared to other kind of policy surveillance processes that we might all have engaged in, gave us really reliable data that we can verify and go back to and talk about with partners.
The pilot project has also really helped us understand how we'd like to use Legal Epi in the future. So we'll continue to use Legal Epi as a tool for future projects. We've even applied for some grant funding for a food access-related Legal Epi project, and we'll keep an eye out for grants and other opportunities to continue to expand our Legal Epi and policy surveillance work. And finally, we've identified what it might take to institutionalize the Legal Epi process at our health department. So the first step is really to sort of find an institutional home either within our unit or within our health department. We also want to build the staff and technical capacity for Legal Epi. So we were a small but mighty team of 3, but how can we build skills and experience with other staff within our unit and health department? So the CDC's Public Health Law Program shared the Legal Epi Core Competency document, which is a really helpful guide as we develop staff capacity. And finally, we really leaned on our external partners for this Legal Epi project, both to identify the project itself and our research questions, and we'd like to involve them more throughout the process moving forward, maybe even with the analysis of the policies. So now that we know more about the Legal Epi process and have a certain fluency about Legal Epi and its value, we'll be able to build out our program. So we're really excited to entertain questions, and thanks so much for listening today.
Thank you so much, Hannah and Deanna. Montrese, go ahead. We're going to go ahead and open up the WebEx Q&A, and you can see instructions on the screen in front of you. As a reminder, you can go ahead and open that panel using the ellipsis button on the bottom of your screen and select Q&A. Once the panel is open, select all panelists. You may then type your question and click send. Montrese, it looks like you have a couple of questions already, so go ahead.
Thank you so much, Bethany. One of the questions that I had that is relevant to a question that we've received is about this idea of an institutional home, institutionalizing legal epidemiology. As someone who works in the public health law program and is really excited about the idea of folks in the field being able to do this work and do it in a sustainable way, what do you think will be, I guess, maybe the biggest facilitators and challenges to institutionalizing legal epi in a local health department? Either of you have thoughts on that, Deanna or Hannah?
I think there are a lot of different challenges here at the health department. I think one challenge and maybe an opportunity is I think there's a lot of potential for connecting what we're finding in the policy analysis to health outcomes, but we face challenges with having data that's available at a local level or at that policy at the same level as these policies. And so I think that's sort of a challenge and an opportunity for us.
You know, I think too, kind of finding the time and support for the kind of internal capacity building that we'll need to do with staff so that folks feel comfortable enough to engage in the process and to be able to lead it with others will be important.
Yeah, and sometimes there's sort of institutional challenges, you know, as a large government agency in sort of building that capacity. It takes time and it can feel slow. So, yeah.
Yeah, I'm sure. You know, you've got there's a storytelling or a narrative piece that comes along with getting people to buy into doing the work and understanding what the impact can be, and that takes time to demonstrate.
Yeah, and I think, too, that there's something to be said for folks getting a real taste of it so that the discussion changes from this is something extra that I need to do and learn to, oh, this really enhances what I'm doing and learning already.
Yes. So you mentioned time and support. There's a question about the types of people who need to be at the table to do these kinds of projects. And you mentioned bringing your lawyers to the table. What types of backgrounds or expertise do you feel maybe were missing from your team? And what types of people did you bring to the table in addition to the lawyers?
So we may have not been clear. So we had a team of 3 folks who were public health background folks, but no lawyers on our team. And we found that that was one of the challenges we encountered because there were some things that folks with a legal background would probably have understood more quickly that took us a little while to adjust to. It wasn't impossible, but it certainly was part of our learning curve. And in an agency where there's access to the legal team, I think it would benefit folks. It's not impossible to do without it, but we certainly felt the absence there a little bit because we were unfortunately not able to engage them. But where I think we had some real, kind of benefit in the team building was really reaching beyond the capacity of the health department to engage partners who had expertise around housing and municipal initiatives. And Hannah's nodding. I'm not sure what else would you say about that?
Yeah, I definitely agree. I think I would hope that we would sort of build a process where each project would maybe have a unique team of people, but maybe some core people that are involved. Deanna mentioned sort of our tapping subject matter experts externally, but maybe there's SMEs that are internal that we would want to engage. But also, if we do want to make this connection between policies and outcomes, how can we work more closely with our epidemiology, maybe not our true epidemiology staff, but our epidemiology staff that are trained in quantitative analysis and bring them on board with the process.
Thank you for that. Now that you've gone through a project, and you talked early on about your project selection process and having to make deviations or changes in your thought process, what might you do differently now that hindsight is 2020 in the project selection process?
That's a great question, and it's a hard one to answer only because we found being wrong kind of valuable. If you define wrong as, oh, that wasn't really the right one, the right initial policy to use for this legal epi project. Devoting that time at the beginning to really think through the project, even if it means you throw a couple out and move on to the next one, there's kind of an element to failing forward there that helped us to learn some things about the policies that we did not use for this process and really kind of center in on the inclusionary policies that we ultimately chose. So while it took some time, there was a lot of learning involved, and I really appreciated what that brought to us and the way that will kind of seed maybe not a legal epi project, but another kind of technical assistance or research or, kind of learning project that we'll engage in.
Yeah, absolutely. And I think that as our department continues to build a program in legal epi and policy surveillance, like just having those projects that we actually decided not to work on, that was a really great opportunity for us to kind of just have those conversations about where we want to go and what the value is for the department, what the value is for our external partners. So I agree with Deanna.
So, I'm looking at our list of participants, and we've got folks that are obviously from different jurisdictions. So if you were talking to another local jurisdiction and you wanted to offer a piece of advice for them as they're thinking about what projects they want to select to work on, the type of support they may need, what one piece of advice might you want to offer a local jurisdiction going down this path?
I really feel like the reaching out to the external partners was really valuable. I think sometimes they have a better pulse on policies that may be under consideration by various municipalities or by different government agencies, and I think they were a really valuable resource for us at multiple steps along the way.
Sure, and I think that my piece of advice here would be to really trust the process. That when we kind of began to engage, and Andy Campbell from Temple was giving us all sorts of training and webinars, and we thought, oh boy, this is a really involved process. There's a lot of pieces here and a lot of stuff to remember as we move forward, and this is going to take some time, right? All of those elements that sound a little challenging ended up being my very favorite parts of how legal epidemiology worked, right? I loved that it was so systematic, that there was rigor to it, that you could go back and point to exactly where you found the answers to your coding questions easily. It felt like we ended up with a really robust data set, and it was really hard to be sloppy, right, just because of the way the process works. And so I would say, kind of jump into that on the front end, and because it really pays benefits out at the end.
That's good. That's very helpful. Thank you both. One last question. It looks like a participant joined a little late. Are you going to write up? Is there going to be a place where they can find access to this information, this work that you've done and the results that you found?
Yeah, actually, on the Legal Atlas website, we've just published our results. So if I think maybe we can send around the link to the people that have called in, but there's it includes our code book, sort of our research process. There's a summary of some of our results. So that's all available on the Law Atlas website. Underneath the housing tab, you can find the Inclusionary Zoning Project.
I just shared the link in the chat box, so that should be available for everybody to see.
Thanks, Bethany.
Sure, my pleasure.
Thank you, Bethany. Okay, let me scroll back through the chat box and see. Here's a question here. Have you found best practices in communicating the value of legal epi, or what you've learned from it, assuming that it's, different from communicating other kinds of policy? How is it different, I would guess, and what are some best practices in communicating the value of legal epi?
That's a great question.
That's a great question.
Yeah. We're kind of nodding thoughtfully over here as we're formulating our answer.
Yeah. For me, what has worked, because there's obviously something in the way you communicated it worked that allowed the project to move forward, right? So
right.
What kind of worked?
Yeah. I think, especially for local health departments anyway, as, many of us are engaging more in the policy systems and environmental change space, really talking about the way legal epi contributes to our knowledge of that kind of policy change is important, or the, kind of systems or environmental change that gets influenced through these policies. And having a more complete understanding of the convergence and variance among the different policies that exist can really help jurisdictions in kind of getting a handle on what might work for them and what has worked for others, and so learn from those, kind of core components that are established in the field. I don't know, Hannah, if you've...
Yeah, and I also see, especially locally, we've seen a lot of different agencies and entities start to kind of incorporate the health lens into the analysis that they do, and so this is a really great way of having a systematic way of analyzing sort of the health impacts of different policies and could be something that they actually even incorporate into the work, their own work.
That's great. Yeah.
So I've got a question here that's a little technical. It's related to inclusionary zoning, but it's two questions from one of our participants. First, can you say more about how density bonuses work within a mandatory inclusionary zoning program? That's the first part, and I think we've answered the second question via the chat box.
Okay. I feel like I can't really. I'd have to do a little bit more research before I would feel comfortable speaking about that. I don't know, Deanna. Yeah.
No. Yeah. Sorry.
Yeah. Apologies.
No, that's fair. Again, it's a technical question. Another kind of technical question, but I think that may be relevant for a couple of the questions asked here. What sort of software packages did you use to collect and analyze the content of the policies? Westlaw, LexisNexis?
Sure. We used Monocle, and it was a package that allowed us to aggregate all of our coding questions and create a set of kind of drop-down or like choice boxes, I forget what they're called, for the answers that we would kind of accept for those questions, right? And then it also had a feature that would let you pin the citation from the ordinance or resolution or a law to the question, so that you not only had the answer to the question, but exactly why you answered it that way, so that, and then at the end, it would kind of spit out the kind of summary of those questions, answers, and citations, so that when the two independent coders were looking at their answers and any divergence they had, it was very easy to identify where we didn't answer the question the same way and what reasons were behind those answers, so that we could then kind of take a look at that and come to consensus. I found that software to be super duper helpful in kind of engaging in policy surveillance in the past and using a Word document with a chart in it with, hyperlinks and then a bunch of other, PDFs that were saved in another file with highlights in different places and notes in the margin. Going back and finding out exactly why you answered one of your coding questions the way you did was so much easier than I've experienced in the past.
And I believe that Monocle was specially developed for the sort of legal epi policy surveillance process, yeah. And I'll share the word over the chat, or the name of it over the chat, so that you can see that too.
Yeah,
I can never remember how it's spelled.
Perfect. Thank you. Thank you so much. Now, here's a question that's process related. Did you guys use adopted date of policy or effective date, and why?
We didn't do any analysis based on the timing of the adoption, although we didn't look at any policies that had been that were effective after December of 2018, based on sort of the time period of when we were carrying out the analysis. But we did look at the effective date. But I think you could do some interesting analysis looking at how, the strength of policies has changed over time, but we didn't do anything specifically related to looking at that particular element of it.
So, thank you very much. There's a question here from a PhD student who says that she wants to use legal epidemiology as part of her dissertation. Mm-hmm. What's one resource that you found most useful to learn from? And I know you mentioned that you learned a lot from Andy Campbell and the team at Temple. But if there's a tool or resource that you found most useful to learn from, what might that be?
I guess I would really encourage looking at existing projects, just looking at the different research questions, the topics, kind of seeing what's already out there, because you can kind of think about variations on those themes or a completely new project. It was just really helpful to see what other organizations and places have done, and just really interesting to see their results too.
Okay, that sounds good. We also have trainings in the Legal Epidemiology Center on the Public Health Law Academy that has been developed by all of the partners on this webinar, hosting this webinar. And you can find that at publichealthlawacademy.org. In the Legal Epicenter, there are trainings on introduction to legal epidemiology, as well as policy surveillance and advanced legal epidemiology methods. So I'd encourage you to check that out. And we'll put the link to that in the chat box as well. It looks like we may have time for one more question. There's a question about, there's two questions actually that I think may be able to answer in the last few minutes. One is, could you explain a little more about how you selected 10 cities, the 10 cities, and why those 10 cities? And I was curious about that as well. And then there was another question that may be a follow-up on that, but I'll let you answer that one first. So why those 10 cities? And why 10 cities?
So 10 cities really kind of fit the scope of the project, as it was really sort of a pilot initiative. And we were very deliberate in choosing those 10 cities. It wasn't a random sample. We were interested in municipal level policies, but we really used, so there were 3 policies that were identified through a website called Homegrown, which was, it's sort of a catalog of different best practices for affordable housing within the Chicago metro region. And then there was additional reports from the Lincoln Institute, and that had been identified by both CMAP and the Metropolitan Mayor's Caucus, that where we selected those policies from. So it wasn't sort of a research-based selection process. It was really based on us really being curious about what are the best practices for inclusionary zoning policies, and that's how we chose the policies.
Thank you. One last question here, and this is related to developers. Are you, or any of you all, or either of you, familiar with what types of incentives are given to developers who provide affordable housing? Based on your research, do you think developers are aware of these policies?
So, we found some of the developer incentives included things like the, relief from parking restrictions or the density bonuses. I'm struggling to think of there was just another one that I was on the top of my head. I
believe there was 4 or 5. We didn't really look at whether developers were aware of those restrictions, but I think they're pretty clearly articulated within the policies, and I think any developer when they're making a decision about where to purchase a property and make an investment really has to keep those different pieces sort of at front of mind when they're making a decision about the investment. So I think a lot of cities across the country do make an effort to make it either sometimes they'll streamline regulations or make they'll do different things to make it easier for developers to understand what the requirements are, because with the idea being that makes it easier for developers to make investments in their community.
Okay, thank you. Checking to make sure we don't have any additional questions that need to be answered. I think we've covered most of them. And I certainly thank you for your time. I've learned a lot on this call, on this webinar. So yeah, I think this concludes the substantive portion of our session. I want to thank Deanna and Hannah for sharing with us. Your contributions have been valuable to our audience and to those of us who work in public health law research. Thank you very much. I want to turn it back to Bethany to close us out.
Thank you so much, Montrese, and thank you, Deanna and Hannah. We really appreciate all your time. Thank you to all of our attendees for joining us today. If you have any questions, you can reach out to us. There's ways to contact us through lawatlas.org, or you can reach out to us at lawatlas@temple.edu. We're happy to answer questions about anything that you've seen here and to provide any additional resources and support. Thank you so much, everyone. Have a great day.